Hello, I'm Dr. Michael Lau. I think it's important for you to know who I am as a surgeon, as is considered doing cosmetic vaginal surgery with me. I'm a fellow of the American College of Surgeons. I was elected to be a fellow in that college because of my expertise and experience in gynecologic surgery. I'm also a fellow of the American College of Obstetrician Gynecologists because I'm a board certified obstetrician gynecologist by American board and also have the qualification to be a college fellow. I'm licensed to practice in state of Washington, where I'm located in the Seattle area. I kept my license in Hawaii because my family is from Hawaii, just in case. So you might want to ask me, how do you become a cosmetic vaginal surgeon? That's a good question. In my case, I combined my training and experience in urogynecology, which is pelvic reconstructive surgery, and my training expertise in cosmetic surgery to become a cosmetic vaginal surgeon. For my urogynecology and pelvic reconstructive training and experience, I actually spent 4 years with Dr. C. Paul Hodgkinson as his resident and then chief resident at Henry Ford Hospital, where I learned to do advanced pelvic reconstructive surgery and breast surgery from Dr. Hodgkinson. Dr. Hodgkinson is a recognized pioneer in urogynecology. He's the first one to describe overactive bladder, what we call detrusor instability. Actually, he invented the first urodynamic system which study and diagnose overactive bladder with it. Actually, I came back to the Pacific Northwest and the first one using urodynamic study in this area. So I set up the urodynamics lab in my office and doing a lot of pelvic reconstructive surgery. Actually, I received the Gynecologic Urology Society Research Award, which later on became the American Urogynecology Society. I study basically using ultrasound to see how the urothoracic junction, the bladder neck, appear and work during urinary incontinence, and I got an award for that. I'm one of the first ones to perform the subuterine sling for stress incontinence in the United States, and also using surgical mesh and biomaterial for pelvic reconstruction. I taught internationally for several vaginal support device companies. I did basic research. I co-authored several peer-reviewed journal papers and a book chapter on biomimetic surgical mesh. Also had multiple U.S. patent applications in the same area. All done in collaboration with Dr. Leonard Pease, who's a professor of engineering and medicine at the University of Utah. Leonard and I got a NIH grant studying biomimetic mesh in pelvic reconstructive surgery, a grant by the NIH. For cosmetic surgery, I was fortunate enough to spend 2 years around 2000, with Dr. Robert Alexander and Dr. Kenneth Tucker, both very accomplished cosmetic and plastic surgery specialists. I learned general cosmetic surgery, mostly breast surgery, abdominoplasty, liposuction, and other facial surgery as well, co-performing hundreds of those cases under their guidance. After my training with Dr. Alexander and Dr. Tucker, for the last 20 plus years, I've been doing cosmetic vaginal surgery and body cosmetic surgery. But for the last 5 years, I just concentrated exclusively doing cosmetic vaginal surgery. I developed innovative cosmetic vaginal surgery technique, combining my extensive experience in pelvic reconstructive surgery and the body cosmetic surgery, emphasizing minimally invasive techniques and using only local anesthetic. I found being a cosmetic vaginal surgeon quite fulfilling. I've been able to provide women worldwide with my unique expertise in cosmetic vaginal surgery to successfully address each one of them their concern over aesthetic or function related to intimacy, and also bring in my extensive experience in sexual medicine as well, since I've been a gynecologist for a long time. I still remember when I first started, this 20 plus years ago now. A young lady came in from a neighboring state who was a nursing student. She was just crying in tears because her labia was large and she was teased by her boyfriend, and she became so insecure with it, this could not be intimate. And she talked to a local gynecologist. Nobody could offer her any solution. She came up and saw me. I explained to her what could be done, did the surgery for her, and she was just so grateful in tears. That gave me an example about how important it is in my job as a cosmetic vaginal surgeon. I can provide this kind of expertise to a lot of people in need of that kind of care. I'm grateful to have a chance to perform clinical research related to cosmetic vaginal surgery and sexual medicine as well, with collaboration with other specialists elsewhere in the world. We presented a professional finding in the conferences worldwide, such as in Paris, Lisbon, Monaco, and Prague. And I found that my career so far has been very rewarding as a cosmetic vaginal surgeon. I would like to invite you to look at the other videos in my library covering labioplasty, vaginoplasty, and other aspects of surgery and sexual medicine. Please feel free to contact my office. We do phone consults worldwide, so I'd be looking forward to addressing your concern through a phone consult first. Take care.